Hello, everyone, and welcome to our February ASHP quarterly webinar for student societies. Thanks to everyone who's online today and who joined us. And we'll get started with a few different updates that ASHP has, as well as other information that hopefully you'll find useful in your student society for both our faculty advisors and also our students that may be on the line. As with every webinar, this will also be recorded. So if you miss part of it, or if you'd like to come back and refer to it, we will be posting the link in your upcoming news link and also the updates for student societies. And for those of you who may have officers that were not able to attend, again, we'll have this recorded and share that with you at a later time. So a couple different things we'll cover today. First, we had a couple requests from faculty advisors given we weren't able to hold our advisor breakfasts given the virtual mid-year this year. And so we have prepared to cover a couple different updates on residency data from the 2020 match. I know this has been traditionally something we've been covering and is of a lot of interest to many of you. So we'll just touch base briefly on that. And we're happy to answer any questions you may have. We'll cover ASHP's newest initiative on diversity, equity, and inclusion, some updates that we are doing as far as ASHP as a whole, and then some updates that will affect your SSHP with ASHP and SSHP recognition. And so we'll cover the information today, and of course, we'll also reiterate this information in your updates and the webpage. And then, of course, with February being PAI week month, we're going to cover a few examples of some successful events that have occurred, especially in the virtual environment. This is a request that we received from many SSHPs as they're brainstorming how to turn their in-person events into virtual events, and as you're thinking about ideas for this year or next year. And lastly, we'll touch on ASHP's experiential education program and some opportunities for your students as they explore what to do in their fourth year and different areas they can look at. So with that, we'll get right on to the first topic and talk about residency data. As a reminder, throughout the podcast, there is a chat box or questions box that you're going to be seeing in your panel. So feel free to share your questions there throughout the presentation. We'll answer them as they go, depending on the question, and then we'll also have some time reserved at the end to cover anything that may be unclear or we can expand on further. So with that, let's start with the ASHP Accredited Pharmacy Residency Program growth. And as with every year, we like to report where we are at as far as number of residencies. As the interest for residency grows and as students are more and more eager to enter the health system's practice, we like to share with you what's going on. As you can see, we've had a 43% increase in the number of programs in the last 5 years, and that trend continued to increase. Even through COVID, we have seen still increase in residency programs and positions. So good news for students who are pursuing residency. You can see that they're broken down by PGY1 and PGY2 residencies, and there's growth in both of those areas. So as you're sharing this information with your students, it's always helpful to share the trend of what's going on in practice. As far as distribution for PGY2s, I know many of our students are interested in pursuing postgraduate opportunities for beyond the first year of residency training. Often we get asked what are kind of the hot topics and practice areas that we're seeing a lot of growth in. So we wanted to note a few significant areas of growth. Again, as you're speaking and advising your students or as you're talking with your colleagues within your SSHP, this is a good one, a good piece of information to have as well. So some key areas that we've seen a lot of growth in have been critical care residencies, ambulatory care residencies, infectious diseases, pediatrics, and emergency medicine. So as you're looking at different opportunities and your students are asking about growth within each of those respective areas, those are kind of ones that stand out as far as percent increase from year to year. And then of course, as you note with many of the specialties listed in this chart, there's a lot of growth, but the ones highlighted are the ones that have the biggest jump that we've seen in 2020. As far as match trends, I know many of you are watching closely, both from students and faculty. So we wanted to share a little bit about what happened with the 2020 match. So we had increases in both the number of applicants and positions that were offered. For PGY1 programs, we had a 2% increase in the number of residencies that were being offered, and we had a 4% increase in the number of applicants. So the number of applicants still outpaces the growth of positions available, but we do have a number of a good growth seeing in the PGY1s and similar traits in the PGY2s. And just as a reference for many of you, many students that may be exploring, there were 498 early commits in 2020. And for our students on the line, that means that the students decided to stay on for a PGY2 in the area that they were pursuing their PGY1. So again, looking at applicant versus positions for PGY1, excuse me, you can see again a growth in 2020, and just exploring that interest in residency is continuing to grow and positions available are continuing to grow. It still is a competitive process, so we always try to prepare students as best as possible to be a competitive candidate. And of course, we offer a number of different residency programs. And for those of you who may have not had a chance to browse through our website, as of last year, the ASHP Pharmacy Student Forum started a new advisory group on residency preparation. So we see more and more growth in the content that we provide to help students in the different programs. And of course, ASHP's residency guide that is continuing to be revamped to offer the best options for students to navigate the process of the match and understand what residencies are. So good data to share with your students. And then another piece of data that might be helpful is the Scramble details from 2020. So at the end of match or phase 2, there were 5 positions that were unfilled for PGY1 and 38 being unfilled for PGY2. So you can see that less and less programs are in the Scramble as the match has been very successful in getting candidates matched with positions. So something to keep in mind as students are exploring the Scramble, it is getting a little tighter, but phase 2 has been a successful way to get students to match into a residency of their interest and follow the similar process. So again, a lot of resources available for phase 2 as students are looking at what opportunities are available if in the event they are not able to secure a position during phase 1. So with that data, I did want to pivot a little bit and share with you some resources that we have for students. I mentioned the student residency guide that's listed here at the end of your slide, but also for those of you interested in more data related to the match, the demographics of who matched, as well as different areas of the number of applicants related to the number of positions and the number of applications related to successfully matched candidates. That data is public and available on the National Matching Service webpage. So it's listed there as natmatch.com. And you will find a wealth of information for this year and also can see historic data. So for our faculty advisors, we found this is a really helpful resource for those of you looking to help students, and for students interested in kind of the profile of successful candidates, this is a good starting point. In addition, ASHP held a town hall meeting during the mid-year clinical meeting to discuss the survey data on postgraduate placement and other statistics. What I shared with you previously is just a few highlights from that meeting. So those interested can access the link. And if you go on your handouts for the webinar today, you'll be able to access the specific links so you can copy and paste it to the browser or just click and open it up. And then you can see more information there as far as what happened and what kind of data we have for residency. So take note of these resources, whether to share with your SSHP and your peers or whether to keep for your reference as an advisor. This is always good data to have handy. And if you have additional questions, we're happy to answer them or direct you to one of our colleagues within the accreditation department. So as always, use the students at ashp.org for any initial inquiries, and then we're happy to direct you further for any additional in-depth questions you may have or other things we can address. So I'm pausing here for just a minute, giving people time if you have specific questions on residency, and then we'll move on to our next topic. So I'll give everyone just a minute to look through and download the handout if you haven't already done so. All right, so we'll continue to monitor the chat box if you guys have questions that pop up. But the next thing we wanted to cover was the ASHP efforts on diversity, equity, and inclusion. And many of you are likely seeing a lot of the news and a lot of the updates that have been going on. A lot of schools are rolling out some programs and initiatives related to DEI, or diversity, equity, and inclusion. So we wanted to share what ASHP is doing on this topic, and then different recommendations that have come out of ASHP's board of directors, and then also different information that might be helpful for you as you plan for your activities for the 2021-2022 year. So to start with, ASHP formed a task force on racial diversity, equity, and inclusion. And this task force was charged with taking an inventory of what ASHP is doing for this topic, and as it relates to issues facing Black Americans today, and students within different schools, pharmacists that are practicing, pharmacy technicians within our profession, and everyone who is impacted. So the task force was really charged with coming up with recommendations on how ASHP can enhance existing efforts in this arena, and also create new opportunities that may have not been addressed up to this point. And they looked at several key areas within that body. So the first one was governance and committees. So looking at how we are staffing our volunteers within the ASHP committees and ASHP Foundation. So looking at the board of directors, commissions, councils, sections, forums, House of Delegates, and of course impacting the Pharmacy Student Forum as well. And then also looking at education and training, as well as some outreach efforts, which is really impacting schools of pharmacy and the way we collaborate and trying to enhance our efforts and understanding of DI within those realms. ASHP's advocacy efforts, research portfolio, publications, and then marketing and communications. So we wanted to just give you some brief background on this, but I also have included the full webpage that includes the task force's recommendations. They are being finalized right now regarding each of these different sectors, and there's a number of bullet points that you should I encourage you to look at, so that you have an idea of where your SSHP should be looking at and what kind of things ASHP is doing that could potentially support you and your school of pharmacy. So take a look at the webpage and kind of browse through the key areas of focus for the DEI task force's initial year. And so that brings us to how this initiative is impacting our student societies. As you know, ASHP closely aligns the requirements of ASHP SSHP recognition with what's going on within the association. So similarly to what we've done in the past with well-being and resilience and folding in PAI 2030, this is a really important area for ASHP, and we want our SSHPs to be involved in the conversation and in the process. So as a result of the task force and the recommendations that came out of it, we are making some changes to the criteria for the 2021-2022 cycle. With that said, all criteria are moving forward, so realizing that the report that you'll submit this summer is reflective of last year's work, this obviously will not be taken into account. But starting next year, as you plan your activities this summer, and as you're thinking about what events you want to plan and what initiatives you want to get involved with, this is one that will be a requirement moving forward. So the requirement will fall under the career development criteria, and it will adjust it to include DI efforts from schools and colleges of pharmacy. So this can be something that your SSHP works with in collaboration to the school, in collaboration with other pharmacy organizations, or an independent initiative to educate or help enhance their impact regarding DEI. And you should expect to see it under 2D, and it will be adjusted to include the well-being and resilience or DEI requirement. We realize there's a lot of different criteria for recognition, so we tried to simplify it and not try to add additional framework on top. So under 2D, you'll now have the option to do an event related to well-being and resilience or DEI, just to satisfy that requirement. Although we're happy and encouraged to see that many schools are already taking initiatives as we're reaching out to our different student societies. So we do hope to see a lot of that good work that you've done reflected on your reports. And of course, anytime that you need ASHP to assist with, whether support a specific initiative or provide a speaker or provide more information about what we're doing, we can always do that. So just email us, and we've been working with a number of you already, and would like to see that continue to grow. So as mentioned, the change will take effect for the 2021-2022 cycle, and the criteria will be posted after June 30th. This is so that we avoid any confusion with SSHPs that are submitting this year. This is not retroactive, so obviously moving forward is what we expect to see from our different student societies. So you'll be seeing that reflected in just a few months, and we'll make that change to the requirements and update everyone so that they're aware. So what should you expect from this change, and what kind of activities is ASHP looking for this particular criteria? So SSHPs will have the option of submitting a project, initiative, communication, educational content, or anything that they developed or performed and initiated as a result of this initiative. And that could include educational webinars, handouts and flyers, speakers that you may have had, different initiatives that the school is enrolling and SSHP is helping support for your respective areas, any communication that you've sent out regarding diversity, equity, and inclusion, recruitment and governance considerations and changes. I know some SSHPs are looking at their bylaws and examining the lens of DEI to ensure that there's opportunities available for all students and helping support underrepresented minorities, and also other programs that might be relevant to DEI that you want to discuss. In the recommendations from the task force, you will see some language that SSHPs can use if they're interested in changing their governance documents. So we highly recommend that you start with that, and then of course email us or let us know if there's confusion or if we can provide assistance. Anytime there's a bylaw change, we're happy to look at your documentation and see if there's anything that needs to be added or changed. So we're happy to support you in this process, but this is really the expectation of what you'll be seeing unfold for the 2021-2022 year. So we wanted you to have a chance to kind of prepare your officers and also adjust the plans when the summer starts and you start thinking about activities for next year. So again, we'll pause for a minute. We'll encourage you again to visit the webpage that is in the handout, and then we'll move on to the next topic so that you guys have a chance to think about other areas that are being, that your SSHP might be impacted by. All right, so as you may know, and we talked about this, we touched on this a little bit last time on our last webinar that we held, and of course in all our communications and updates. This month, February, is PAI month, and so we encourage SSHPs to choose a week within February and hold their PAI events. A number of you, when this was announced, had already conducted your events or had already planned for a different time frame. And of course, for this year, since it was a change from last year, there is no penalty if your PI week was not in February and it was in a different month. But in the spirit of embracing this new time frame, we wanted to provide you some ideas of what your SSHP can be thinking about in different areas that other societies have done to fulfill this requirement. Again, it's an ASHP SSHP recognition requirement, and also a huge initiative that ASHP has been fostering really for a number of years now, since 2010 formally. So what is PAI Week? It is a celebration and promotion of ASHP's Practice Advancement Initiative, and it really aims to educate students about practice advancement, educate the public about the pharmacist's role in patient care, celebrate the profession of pharmacy, promote patient-centered care, and stimulate discussion on the future of pharmacy. This is an opportunity for student pharmacists to embrace their role in the profession and where they want to see it in the future as they embark on their residency journey and then their practice journey. So the PGY events can be anything that the SSHP feels is educational, helpful, contributes in some way in advocacy or practice change. So we do allow quite a bit of creativity with regards to what kind of events you can do, but the goal should really be to celebrate pharmacy, to promote the initiative, and help educate students and the public about what pharmacists do, often even interprofessional colleagues, and also start a discussion about what pharmacists can do and where do students want to see the profession go. So PGY 2030 is a set of recommendations that came out as a result of a discussion of numerous pharmacy leaders. And those 59 recommendations focus on practical recommendations on what we should do in order to see pharmacy advance, and so that we're not taken by surprise by changes in technology, changes in patient care, changes in expectations, but are really following and setting the trend for our profession. They're meant to be aspirational, and they're also meant to be future focused. So what do we want to see in the future? And you might wonder, how do these recommendations apply to the student society? They are about a variety of settings, and they could be a recommendation about an individual, or they could be a recommendation about an organization. And really, students are encouraged to learn more about them and engage with health systems leaders to understand how this change will impact their practice in the future, and also educate their peers about what this is so that they can be action oriented when they graduate. There are 5 primary domains within the PGY 2030 initiative, and often what we see SSHPs do is utilize these domains as anchors for their PGY week, or utilize these domains as ideas on what kind of events they would like to center their programs around. So there's patient-centered care is one of the domains. How do we look at patients and ensure that they are being included in the care that they receive? So it's a dual relationship of two-way communication. Pharmacy technician role in education and pharmacist role in education and training. So how do we practice at the top of our license as a workforce? Technology and data science, so looking at technological changes and how they impact the pharmacy profession and patient care. And then medication use and safety, so how do pharmacists continue to lead in this area? So once again, students can participate in this initiative by promoting the initiative and helping educate their peers about what those recommendations are about and why they're important. They can engage in conversation through ASHP Connect. We have a number of threads that are discussing this, and also journal clubs that are done monthly that connect back to PGY, and also encourage you to host events as part of recognition, but also for the sake of participating within the initiative. So there are 2 references that we've listed there for you. One is a resource guide on how and what kind of events you can conduct for PGY. So for those of you that are approaching this for the first time or looking for refreshed ideas, visit this guide and see what kind of events and programs you can implement at your school. And then also check out other examples of past successful SSHPs and how they've accomplished the impact within their institution. So many of you have reached out and asked, how do I turn my in-person event in virtual, or what ideas and what support can you provide in order to look at more virtual opportunities? So we do have a number of resources on our webpage, and that can be found under the PGY 2030 Student Resources page. But then also we wanted to present a few different ideas that have occurred over the past year and have been successful in engaging different students. So one idea that has circulated and has been successful is electronic news links that schools have initiated with reflections on student experiences with PGY discussions with health systems leaders within their student society that sparked conversation and passion about practice advancement. Journal clubs that they're doing, whether in conjunction with ASHP's national initiatives and engaging in that regard, posting on behalf of the SSHP about PAI, or just independently sharing their thoughts and participating. We've also seen a number of infographic and a social media challenge that was done to really promote the role of pharmacists for a public perception of what pharmacists do, and then educational materials that relate to each of the different domains. One particular example that sticks out was one SSHP had a social media challenge where the public was encouraged to ask the pharmacist a question every single day, and then they posted a response to that, and it really encouraged a discussion on what pharmacists can do, and it picked up a lot of traffic because it was not only within the school but also peers outside of the pharmacy school within different health professions, and then also within your private network. So that was a really neat way to display how pharmacists are continuing to advance. Of course, virtual speakers are always a possibility, especially in this environment. And I do want to remind you that you can always email students at ashp.org and request a speaker for your SSHP related to PI 2030 or any of our other large initiatives or even residency information. So we always are available for you to take requests for a speaker if you're struggling to find one from your local network. And then also pharmacist spotlights and interviews. So ASHP does have a spotlight page, but we find that it's helpful for SSHPs to reach to their local network and have pharmacists be featured, whether in a classroom environment, a virtual presentation, or even profiles that are available, just to spark some interest on the different ways that and the different avenues that are available for students post-graduation. So again, check out our residency program resource, check out our resource page for virtual ideas and get more information there. One of the documents I mentioned is the resource on past examples. And so we wanted to bring out a few virtual opportunities that we've seen from the SSHP recognition applications last year that had already turned virtual. So one of them is a virtual workshop with speakers. So every day of PI week, they tackled a different domain from PI 2030, and they invited speakers to lead a workshop each day on those different areas. And so that was a really successful event as far as participation. It helped stimulate discussion and also allowed students to see a different flavor of pharmacy each and every day. Really think about what barriers and opportunities are available within the profession and how can the SSHP provide assistance, whether through advocacy, through different support of the health system, through programmings and shadowing opportunity that came out of it. So lots of good discussion there. Pacific University School of Pharmacy did a student questionnaire on health literacy, so honoring the medication use safety domain of PAI. They work with students to address health literacy for themselves and also patients, and how can they contribute to ensure that they can increase that area. And they did educational sessions and really assessed the students' understanding before and after the educational content. And also provided a lot of pamphlets for them to utilize in their own patient care and outreach within the community. So yet another innovative idea in addressing, here's an example of just one domain versus addressing all of them at once. And the Ohio State University and also the Medical University of South Carolina did another 5 to 6 series following each domain, and that included panels, roundtable discussions, trivia questions, and they also included a technology tour, and one of them is turning into a digital tour, working with their local health system and kind of showing the different technology that is available, the different robotics that are available, the use of artificial intelligence potentially within the health systems, and discussing new and upcoming opportunities within pharmacy. And again, learning a different perspective of pharmacy for students that may be interested to explore other pathways professionally. So those are just some examples that we wanted to just share so that we spark some thought and creative implementation of what you can do. Again, a lot of these were done virtually, and many SSHPs have been able to successfully translate their in-person events to virtual. And as you're thinking and planning, if you are struggling to come up with ideas, or if you find that you came up with an idea and you just kind of want to run it by us, we're available. So email us and we'd be happy to get on the phone with you and kind of talk through the initiative, or even talk about what opportunities there are for your SSHP. So again, I'll pause for a minute so you have a chance to download the guide or click on those web pages and find more information. And then in general, if you're looking for more information for PAI, if you go to ashp.org/PAI, then you'll find all the information about the initiative with literature, and you'll also be directed to the student page there as well. So there's multiple ways you can get to that page. Okay, and last but not least, we wanted to touch on ASHP's experiential education program. A number of students this year have had interest in exploring non-traditional pharmacy opportunities or getting involved within the association level as a fourth-year student. And some even were looking for virtual opportunities that would satisfy some requirements for their elective rotations. So we wanted to make ourselves available and kind of share with you what programs we have. So that in case your students in the fourth year are exploring, going into their fourth year, are exploring some more elective rotations, what we have to offer here. So ASHP offers a fourth year APPE rotation. It is a rolling admission, and so we realize that February and March are typically when most assignments are being made for rotations with various students. So this is a good time for us to kind of share with you this opportunity in case your students have interest in exploring further. It is an elective rotation, so obviously there is no hands-on clinical care responsibilities, but you get to learn about the different initiatives within ASHP. You get to work on a number of different offices and departments within ASHP. We do offer in-person rotations typically. With the pandemic, we obviously have transitioned to a virtual environment, but we do offer 4 or 6 week rotations depending on what your school requirements are. What students are involved with while they're on their rotation is association activities and operations. So anything from member relations to marketing strategy to understanding how ASHP plays a bigger role within the advocacy space in the community, and what kind of things we do work on a daily basis. Working on quality improvement, professional, student, and public affairs, and then also government relations and policy work that they may engage in and learn more about. So how do we turn ideas and issues into action, and how does change get made on a national level, bringing stakeholders together. So students really get to work on a variety of topics depending on the time of year that they're here. And of course, we have a complete list of objectives online, and students can have a concentration within one area or another depending on their specific interests. So the application process is online, and I've included the link at the bottom of this page in case your students are interested or you're interested personally. What we require is an affiliation agreement between the school and ASHP. A number of schools have already affiliation agreements in place, but if you're the first student from the school coming to us, we would need that. And typically we work directly with your administration to take care of that. You just put us in touch with the appropriate person. There's an electronic application that you have to submit. That includes your CV or resume, a cover letter, and a reference letter. That also requires a formal endorsement from your school, so your experiential education advisor would need to sign off on this, and then official or unofficial transcripts so that you can display to us that you're in good standing from the university. So those 4 steps are really the application process, and we try to have a pretty quick turnaround. So from the time of the application, typically we get back to you within a few weeks. And it's a rolling process, but we do ask that you notify us at least 3 months in advance of the time that you be intended to come. So if you wanted to start a rotation in December, we would ask that you notify us by early fall so that we can make appropriate plans. So with that, that is all the ground we wanted to cover today. It's a fairly brief update, as I know many of you are busy with interview season and thinking about residency or deep into the exam periods. But again, this will be recorded and it will be available to you at any time. And then for questions or clarifications, or if you want something to share with us, email us at students@ashp.org.